Practical Nursing students, Darlene LaPresto, JC instructor. This video is going to cover administration of subcutaneous injections. Okay, so we have here with us all of the supplies that we need, and we're going to be demonstrating with insulin today, and part of your assignment is to fill out your medication tracking sheets because we want you to know what your medications are when you come in to do your checkoffs. This is how you're going to start learning what medications you're giving. So you will have to do one on each of the insulins that we have here. We have NPH insulin, which is an intermediate acting insulin, and as you can tell, it's cloudy. And then we have regular insulin, which is a short acting insulin, and you can see that it's clear. Now, the way that you draw these up is clear before cloudy. Clear before cloudy. You have to memorize that. Clear before cloudy. We're only going to need one syringe, so I'm going to set this off to the side. We're going to do some hand hygiene. So you would go in and do the G-NAP with your patient. You would check his armband, 2 client identifiers, check for any allergies, double check your medication administration record and make sure that you are giving the correct medication. And when you draw up insulin, you have to double check it with another nurse in most facilities. All right. So for subcutaneous, I'm going to get my vials ready first, so I'm just going to clean the top of them off with alcohol. Friction, and then time to let it dry. Now the NPH we have to roll to get it mixed. So don't shake it, shake it, shake it. You just want to roll it. And then I'm going to just clean it off one more time. Now, we want to add a little air to these vials because anytime you take volume out with liquid, you want to replace it with some air. So we're going to use a insulin syringe. And I'm going to get some gloves on. And your book talks about adding air to the cloudy first, then adding air to the clear, then drawing up the clear, and then drawing up the cloudy. So that's what I'm going to show you. We don't want to access these vials more than we have to. So we're going to say that we need 60 units of NPH. Well, let's do 50. So I drew up 50 of the air. I've cleaned off the top of my NPH. And I'm going to inject straight in and inject the air. Now you're going to have to remember what parts of your needle are sterile and not sterile. So anything that touches the client and anything that touches the medicine is sterile. Alright, so we've got the air in there. Now we have to do 20 units or 2 units of regular. We're making up numbers here. So I draw up that much air in my syringe. I've already cleaned off the top, pierce the septum, and put that in. Now I'm ready to draw this up because again the rule is clear before cloudy. With these syringes, be really careful, hang on to them. You don't want them flopping around because the needle is really fragile and it will bend really easily. So invert it so the fluid all comes down to the bottom and slowly withdraw. And if you get an air bubble, that's okay. You can hang on to it like this and you can tap it. But again, remember, don't bend that needle in there. Some people do like an airlock, and what they do is they take the plunger and they push it up really hard and then they start drawing out. And for some reason that works. I never get a drop of air in it. Not so much for me. But alright, I'm going to draw up the point 2. I've got just a little bit of air bubble in there. Alright, and again, you're going to double check this with the nurse before you move on. So my camera person is nodding her head yes, and I am good to go. Alright, now we're going to go to the NPH. I've already cleaned it off. Now, you have to be careful. You don't want to inject. We're simply adding 2. So 20 of regular and 50 of this is 70. So we're going to go up to the 70. Now the trick with this is to make sure that you don't touch this plunger because it's supposed to be sterile. Alright, double check. If there's any air just take the vial off, because you're not going to inject it back in, and just carefully tap it. But you want to make sure you have exactly the right amount. Double check it with your nurse to make sure it's okay. And now we need to walk down to the client's room. So you're going to do a scoop method, because we never recap needles. That's how needle sticks happen. So now we can go down to see our patient. We're going to take our medication administration record with us, which I will show you in a different video. And we're going to go to the bedside. Again, we're going to introduce ourselves, identify our patient with the 2 client identifiers, name and date of birth. We're going to let the patient know that we have his insulin ready, that we've checked his blood sugar. It was 109, so it's okay to give it. All right, so let's prep the site. Now, you can give insulin injections in several areas. Patients, when they're at home, they use their abdomen a lot or the tops of their thighs. So it's nice when they come to a facility that we use their arms or the back, their back, chubby wubby I call it, the back fat, like right above your iliac crest and then right below your scapula. And that's in your textbook, chapter 37? Yeah, chapter 37. Be sure you take a look at that, because you're going to want to know where those sites are. All right, we start in the center, and we rotate out in a big circle. Allow it to dry. Again, it's friction with the alcohol, not just the alcohol. And I do it twice. You don't have to, but I do. Okay, let it dry. Now with a subcutaneous injection, you're going to pinch up the skin. You're going to go in at a 90-degree angle, or excuse me, 45-degree angle, sorry. This is 90, 45. The blonde's real. Pinch up the skin. 45-degree angle, nice swift movement, don't hesitate, and bevel up. And when you're looking at these syringes in person, you'll know what I mean when I say bevel up. And this is in your book as well. The hole in the end of the needle is the bevel, and you want that to be up because it'll pierce the skin easier. So I just say to the patient, and I put my hand on their belly just to kind of stabilize my hand, and 1, 2, 3, poke. And just really soft, nice, steady, easy. Okay, then withdraw. You can let go of the skin. Do not massage when you give a subcutaneous. Just make sure that it's not leaking. Engage the safety guard over the needle and discard. Okay, and that's all for that one.